The pelvic floor muscles, or PFMs, surround the base of the bladder and the urethra. Strong PFMs support the bladder and prevent accidental urine leakage between trips to the bathroom. Simple pelvic floor muscle exercises can strengthen the PFMs and can improve symptoms of both urge and stress-related urinary incontinence. Before you start, it's important to know which muscles you're supposed to strengthen to improve bladder control. Here are a few tips for finding your pelvic floor muscles. With an empty bladder, lie on your back with your knees bent upward and your feet planted on the floor. Breathe normally, don't hold your breath. Place one hand on your lower abdominal area. Place your other hand on your vaginal area. Try to pull your vagina deeper inside your body using your pelvic floor muscles. You should feel your vaginal area lift in and away from the hand that's between your thighs. Although repeatedly interrupting your urine flow midstream can hurt your bladder, the pelvic floor muscles are the muscles used to slow or stop your stream. For some people, it helps to visualize the motion of sucking water through a drinking straw while they squeeze the pelvic floor muscles inward and upward. Make sure you're not tightening your belly, thigh, or buttock muscles. There should be very little movement in the hand that's placed on your abdominal area. The key to making pelvic floor muscle exercises help with bladder control is to perform them in the following 2 ways. First, tighten and relax the pelvic floor muscles as quickly as you can. These are called short contractions or quick flicks. These can also be used during bladder training to distract you when you're having an urge. Next, tighten the pelvic muscles and hold the contraction for a number of seconds. These are called long contractions. Relax your PFMs between each contraction and make the relaxations last as long as the contractions. These exercises can be performed standing, sitting, or lying down. For most people with weak pelvic floor muscles, lying down tends to be the easiest position for these exercises, but do what works for you. A sample starting set might include 5 quick flicks, followed by 10 3-second long contractions, and finishing up with 5 more quick flicks. You should do this twice a day. Over time, you can gradually add more repetitions to your sets and hold the contractions longer. Go at your own pace. A long-term goal might be to do 40 quick flicks, 10 10-second long contractions, and another 40 quick flicks. If you're having trouble doing PFM exercises, don't be embarrassed to ask a doctor or other healthcare professional for help. They can give you important feedback to learn how to identify and exercise the correct muscles. Strengthening the pelvic floor muscles can take time. It might be 6 weeks or longer before your symptoms start to get better. When it comes to pelvic floor strengthening, it's extremely important to be persistent and consistent. Once you master these exercises while standing, sitting, and lying down, try practicing them while doing other activities or exercises to challenge yourself. If you do pelvic floor muscle exercises regularly, you can expect your incontinence symptoms to get better over time. If you stop practicing these exercises, your symptoms may return. For long-term results, plan to make pelvic floor muscle exercises a permanent part of your daily routine.